lot to get through. So let's jump right in. Reminder to go to the member site to see any announcements, and you'll see that all the courses that you guys have full access to, and we actually have our new genetic course up already. So you'll have access to the 5 courses that we have. And again, you log in to the courses using your same username and password that you do for the member site. So you go to any of these courses, you can learn something new, maybe. All right. With my current levels of anemia, do you still suggest only food sources of iron and advise against any iron supplementation for me? So no, if a person has significant iron reduction, a significant red blood cell reduction, significant anemia, increased red blood cell width, etc., showing anemia of chronic disease, it may be time to use iron supplements as well. So if you do take iron supplements, take artemisinin or take berberine with the iron supplements, because berberine and artemisinin tend to be carried in with iron. So you could kind of use it to your favor. So understand, cancer cells can feed off of iron. That's the danger in just jumping in and taking iron supplementation right away when you have even the slightest hint of anemia. But when you have significant anemia, you need to really use iron supplementation as support. So the fact that studies have shown that artemisinin and berberine can be carried into the cancer with iron, make sure you take artemisinin or berberine or both with your iron supplementation. Dr. Tom is in favor of me upping my B vitamins. Do you agree? Yes, you can. There's no real high limit of B vitamins. It's just too many methyl groups. So if you're making sure that your B vitamins don't have a ton of methyl groups, then you can take your B vitamins. We also suggest that your B vitamins consist of whole food B vitamins. That's why we use the B specific naturally, because it's a whole food B vitamin, not a synthetic B vitamin. Number 3, to help my improper thyroid levels and edema, Hoxsey has changed me to their non-iodine tonic and prescribed 2 capsules per day. 2 capsules per day, 40 milligrams each, of the thyroid from Allergy Research Group. Is this thyroid supplement okay? Yes, that is a glandular. There's nothing wrong with that supplement. So I would just get your thyroid levels checked again and see what they're at, and monitor that with what you're taking. Also with thyroid, you want to monitor your symptoms. So if your thyroid levels, meaning your free T3, free T4, and your TSH are within normal limits, but maybe on the low side, but your symptoms, you don't really have any symptoms of low thyroid, then I wouldn't necessarily change my dosage. So I don't recommend dosage of either synthetic thyroid like Synthroid, or dosage of supplementation, nutritional supplementation of, let's say, desiccated thyroid, etc., based upon the blood test. You monitor your symptoms, and that's how you really regulate dosage. I think I have some videos on thyroid that will help you maybe. Hoxsey has updated my protocol with them to 9 U capsules per day, 3 tablets Laetrile per day, 2 thyroid capsules today, the Floridex. I'm taking all except the Floridex. I think you can take the Floridex. The Floridex is an organic source whole food iron. So that could be the source of iron that you're taking. The only thing that I'd recommend is that you take some berberine or artemisinin. Artemisinin is the preferred one with the Floradix. That will help. My inflammation is not going away. I don't eat gluten or dairy and very little sugar. At Christmas time, I ate cookies. Inflammation started. After 10 weeks, it went away. But at Easter, I had a few cookies. Inflammation came back again, but went away. The inflammation came back, but I don't know why. I hope you can help. The only thing I can think of is I had some rice. Okay, so inflammation can be caused by a food sensitivity. So if I have antibodies to gliadin peptides, that's peptides of gluten, or casein peptides, and you eat casein or gluten, then you're going to cause this ramped up inflammation. So if you have that take place, you have to eliminate gluten or dairy or both from the diet. Now, the best way to know that you have food sensitivities is to do a test. The Cyrex lab is the best test for food sensitivities because not only do they measure the whole protein, because you get food sensitivities to food proteins. So, but more specifically, you get food sensitivities to portions of food proteins. That is called a peptide. So gliadin is the protein in gluten. Well, gliadin breaks down into numerous different peptides. Those peptides can cross a damaged gut wall. And if they cross a damaged gut wall, you can start to develop through your B cells, part of your immune response, you'll develop antibodies to that peptide. So now every time you eat gluten, you fire this immune reaction. That's called a gluten sensitivity or a gluten allergy. That's not celiac, that's called a gluten allergy. This can happen to any food that you eat. So let's say if I'm eliminating dairy and gluten from my diet, but so I'm eating a cookie that doesn't have, it's gluten-free, and I can't figure out why I reacted to it. You could react to some other thing in a gluten-free flour mix. Now, there's lots of different gluten-free flour mixes on the market. So I have no idea what it is that you're reacting to. Nobody does. You'd only be guessing. That's why you do a test. So Cyrex Labs has their array 3X, their array 4 that measure gluten and all its peptides, including array 4, all of gluten's cross-reactive foods. Or if you want to get real serious, you also run array 10, which measures 180 different foods and their peptides, cooked and raw. That's the very important thing with Cyrex. They test both cooked and raw peptides, which is really important because you're not just eating raw food, you're eating cooked carrots too. So that's the way you'd find out what it is that is causing inflammation. I have some videos on that that you can look at as well. So if you go to our YouTube channel, I just uploaded several videos on Cyrex testing that would help you too. Dental was listed as one of the causes of my cancer, but I've never even had a cavity. So I was wondering what is going on with my mouth. The only dental work I've ever had done is getting a couple of baby teeth pulled as a child to make room for wisdom teeth extracted in my early 20s. I go to the dentist twice a year, and the only slight problem I have now is some sensitive areas where my gums have receded slightly, but they have not raised any red flags and measure them yearly. So dental infections, subclinical dental infections are a major cause or a major causative factor, let's say that, to cancers. So you don't have to have any symptoms. You don't have to have any root canal teeth. You don't have to have any problems. So you do want to use that product that I recommended, that Biocidin product. You might only have to do it for 3 months. It's a 3-month protocol. And you might be done, and that's it. And that's when we should test you and retest a cheek swab anyhow. So you don't have to have any dental problems. As a matter of fact, 9 out of 10 people will say they go to the dentist, they don't have any issues, but their teeth actually can be a piece of the cause of the cancer. How do I best keep weight on while keeping a time-restricted eating window of 5 hours? My only diet restriction is no dairy. Also, if keeping insulin glucose levels low is the reason to do this. So understand that keeping insulin glucose levels low is partly the reason to do time-restricted eating, but time-restricted eating does a lot of other things. It's a form of fasting. So it changes your mTOR pathway. And I talked a lot about the mTOR pathway in different things. You could look up, hey, you could go to the gene course. It's a picture that will sit right there. And you could look up the mTOR pathway because that will help you understand this a little bit. Yes, you're trying to starve the cancer, but will having a smoothie increase my glucose too rapidly? No, you can go ahead and have a smoothie in the eating window. And that eating window of 5 hours is not a magic number. So I think this person is already doing an eating window of 7 hours. You could stay at that. That's fine. And you could try to do an eating window of shorter, maybe a couple times a week. That would be fine too. What you don't want to do is you don't want to be losing weight. You don't want to be in a state of rapid weight loss. That means if you're losing 2 to 3 pounds a week while you're trying to eat as much as you possibly can in the eating window, then we have to open up that eating window even more. So it is a trial and error. So just keep track of weight loss. Maybe I should stick to nut butter and protein powder and don't even use low glycemic fruit. No, because low glycemic berries, the nutritive value of fruits is so important as well. So there's just great antioxidant and nutritive and cancer killing products in your berries. So I'd hate to have you reduce that. I read when you drink your meals, there's not the same digestive process because ideally it starts in the mouth with chewing. Well, there's some truth to that. When you chew, you start to release hydrochloric acid in your stomach, but when you swallow something, you're going to release hydrochloric acid too. So really, it's the better explanation of that is that you're better off not chewing if you're not going to put something in your stomach. Well, when would you do that? When you're chewing gum. So I'm not a big fan of chewing gum because if you're chewing gum, it's basically telling your stomach to release hydrochloric acid, and then nothing is coming down there unless you're swallowing your gum, which I don't recommend either. So, but if you just drank your meal, you're still going to release hydrochloric acid because as soon as something goes in your stomach, you're going to release hydrochloric acid too. But the act of chewing will cause the release of ptyalin by your salivary glands, and it will cause the release of hydrochloric acid in your stomach. So not a good idea to be chewing gum, at least on a regular basis. Fine once in a while, but also, I have read too much protein can be a bad thing. Is there a guideline for that? Well, too much protein can be a bad thing for certain people with certain types of cancer. This person, that's not an issue, so you don't have to worry about that. Can and how can I use a TENS unit to alleviate foot and hand neuropathy? Absolutely. So I'm very pro TENS unit. You could use a TENS unit on a lot of things. I mean, TENS unit is going to mainly affect muscles, but it's going to affect the nerves too. You don't certainly want to put a TENS unit over cancer. So use some common sense about that, but certainly using a TENS unit on your legs, absolutely a great thing to do. TENS units are great. They're cheap. They're really, everybody should have a TENS unit at home. Since I don't have access to oxygen chambers, are there other options? I've also heard some people would put a soaked towel of hydrogen peroxide over the location of their cancer to provide oxygen. Is there benefit in doing this? I've heard that too. I cannot, for the life of me, imagine the physiological process that would actually release oxygen into the in through the skin into the tissue. So no, there can be danger in hydrogen peroxide too. You have to be careful. Hydrogen peroxide is an oxidative agent in itself. And just so the misnomer, I'm pretty sure I have a video on this, the difference between an oxidizing agent and oxygen. So an oxidizing agent is a molecule of oxygen that's a free radical. So those are reactive, those are called also reactive oxygen species. They damage your cell membranes, they can damage your nucleus, and they can cause cancer. So reactive oxygen species, other free radicals are basically dangerous because they can cause damage. And so so the idea was, okay, well, hydrogen peroxide, that's going to be good because that's going to kill cancer because it releases oxygen. Now, it releases an oxygen ion, and that can be damaging. So ions are unstable molecules that want to attach to something, and if they attach to a cell membrane or they attach to they could be good because if they attach to a bacteria, they could help kill a bacteria. So hydrogen peroxide on a wound is actually good because it liberates a free radical of O2 minus, and then it will attach to bacteria or viruses in the wound, and it will kill the bacteria or virus. That's a good thing. So it actually works real well as a topical antiseptic because it forms free radicals. So hydrogen peroxide is H2O2, and it tends to give off oxygen free radical and then convert to H2O. So you don't want those oxygen free radicals in your body. So people that consume hydrogen peroxide, thinking that it's going to be good for them because I'm going to consume it, it's going to kill things in my body. There's danger to that. Yes, it could kill bacteria in your stomach. It could kill bacteria in your intestinal tract. But if you have those oxygen free radicals, they cause damage. Further, they cause peroxynitrate. So they bind together and they cause what's called peroxynitrate, that it's a very strong free radical and a very strong cancer causing agent. You actually have systems in your body through your SOD catalase pathways that help break that down and get rid of that. So you're not increasing O2 oxygen in your tissue by use of hydrogen peroxide. I'll guarantee you that. That's just wrong biochemistry. Whoever came up with some of these ideas, it's not correct physiology or biochemistry. So I would say no to that. I just received my genetic results, and one of my action steps is to avoid foods and high oxalates. Okay, so I have to apologize. I know the person that wrote this question, and I wrote their genetic review, and I didn't delete that paragraph that says avoid foods with high oxalates. So I apologize. That's not you. As a matter of fact, the person that is on this call that I just did their genetics, that this said that has one of the best genetics that I've ever seen. So, you should get a blue ribbon. But even if a person did have issues with oxalates, I would still say you use greens first. There's not enough oxalates in there to make a big difference. The only time that I'd say you have to kind of do a fast of all your supplements is if you have super bad oxalates, plus you have super bad kidney stones. It's time that we need to change the protocol. I got the RGCC vaccine prep this afternoon. Should I alter any of my supplements? No, stay on everything you're doing. After my last blood work and red and white blood cells were down, it was suggested that I take B12 prohydroxycobalamin. When I got the bottle, I see that it has milk in it and dairy. Is that something I should stay away from? Is this okay to use? Yes, there's not enough in there to make any kind of difference. You go ahead and take that. When I had pneumonia and COVID, I was taken off Ibrance for 3 weeks, and the doctor started me back on it 9 days ago. Last Thursday, I started having back pain and some shortness of breath, and was in the ER this morning from the pain. The doctor says it has nothing, it's not from the Ibrance, but I didn't have this pain for a week or more before I started back up on the Ibrance. I'm taking clear inflammation. Any suggestions? Whenever you have a reaction to any drug, it's always good to Google that drug and see if the side effect that you're having is listed in their side effect things. So whenever you watch a commercial about a drug and then they have to have somebody that is can speak 400 words a second, give you a disclaimer on the drug afterwards, saying all these things, and they say even death. That means, understand again, that means that when they tested that drug and they sent it out to 30 different universities to test that drug on 100 patients each, that drug caused those symptoms in the best studies that they published. So when they do a drug, they do drug testing, phase 3 drug testing. They have to get these tested on human beings. And they send them out to multiple universities to do tests on. And then let's say they'd sent them out to 30 universities and 28 of them had negative results and 2 of them had good results. They have the choice to not publish the 28 negative results so nobody ever sees them. And they only publish the 2 with positive results, but they have to publish all the negative data as well. So if somebody died from it, it was on the positive result table. So not to say that you shouldn't take the drug, not saying that, but should be aware of the side effects of it. So what else to do for the inflammation? Clear Inflam is a great product for inflammation because it has a lot of the flavonoids in there, but it's, you have to take a lot of them. That's the only negative. But this is just no other way of getting around it. So you certainly could add some turmeric to your shake. Any way you could get anti-inflammatory products in your body, using Kirkland Clear, using the Clear Inflam, just up the dosage is big time on those things. Does DIM do the same thing as letrozole? So letrozole is an aromatase inhibitor given to women with breast cancer that is ER/PR HER2 positive. If I understand it right, letrozole stops all estrogens and DIM does not. Yes, you're exactly right. So DIM is a natural product that will help pull out some bad estrogens, but it's certainly not going to remove all your estrogens. So aromatase inhibitors just basically block all estrogens in your body, and women do not like the way it makes them feel usually, even if they're postmenopausal, because you still have estrogens even if you're postmenopausal. Even if you've had surgery to have your ovaries removed, still your adrenal glands make estrogen. So when you take a drug that removes all your estrogen, it makes you feel different because estrogen has a purpose. So remember, it's only the quote unquote bad estrogens that have anything to do with ER/PR HER2 positive cancers. Why do we need to remove all of them? Well, the answer is because we have a drug that does that. So we're just going to do that on everybody. Is it the right thing to do? Well, you have to answer that question yourself. Certainly using things like DIM and AromaClear, it's a new product we have. It has DIM and I3C and several other ingredients, EstroClear. Those are just different choices that you can use to try to do the same thing, kind of, because you're not trying to pull out all the estrogens, you're just trying to pull out the negative ones. Do you work with any oncologists that understand cancer like I do? Well, I don't know if I understand cancer at all. So, but certainly we don't work with any oncologists that think the way we do. And the reason is quite simple. It's because they can't. So if they do think like I do, then they can't voice that opinion. So unless they just leave the practice of medicine and practice under, the same thing that I did and have to practice under a pastoral medical license or something like that, because
they would lose their license. So that's, I gotta understand, we get the Minnesota Medical Board coming after us right now because they're saying I'm practicing medicine without a license. So this is just the fight that you deal with when you go against the pharmaceutical companies. They just don't like people like me, and they will fight people like me. And certainly you cannot be a practicing oncologist and think alternatively. I don't actually know a doctor right now that I know this doctor personally. She practices in emergency medicine, and she had a stage 4 cancer patient come into the ER, and this person was very overweight, and explained, she asked what's going on, and the person was having a lot of symptoms, I think gut symptoms. This person was explaining what they eat, and the doctor said, well, maybe if you got cancer, you got to start thinking that maybe you shouldn't be eating cake and donuts. And the other practicing physician that I think was in rounds with her, learning from her, heard that she said, if you have cancer, maybe you better stop eating cake and donuts, reported her to the Minnesota Medical Association, and she's under investigation now for recommending that the stage 4 cancer patient not eat cake and donuts. This is where we've come, folks. So this is just what we deal with. What do you think about ivermectin and cancer? So ivermectin and cancer has got some really promising medical studies that are out that show that it can be beneficial. Again, you could do a Google search on ivermectin and see that there's not really a whole lot of side effects for taking ivermectin. So that's a choice that you could choose to add to your protocol. I can't tell you that's a prescription medication, but that would be something you can certainly choose to add. Okay, some questions from the chat. Do you have any thoughts as a Christ follower about the practice of Reiki? Yep, just my personal experience, I would not go to a Reiki practitioner. You know, I know some about it. I don't know a ton about it, but if there was a Reiki practitioner that was a believer, and I just feel like you could be summoning spirits that you would want to be summoning. Okay, did I get to question number 1 for you? This question right here, with my levels of anemia, do you suggest adding iron? I said yes, you could add iron, and certainly Floridex is a product that you could use, but there's other good sources of iron. I would just make sure that you take artemisinin with it. Can you repeat the product that you mentioned regarding oral health? And that product is a Biocidin product. It's a brand new product they came out with. Let me look it up real quick, because it's a new product that we have from them. It's called the Dentalcidin Oral Care System. Dentalcidin. There's a picture of it. Somewhat similar to early questions, I'm worried about my modified Gerson diet has so much sugar from fruits or lemons. Well, I wouldn't worry about the sugar from the lemons, oranges, apples, cabbage, romaine, bell peppers, plant-based protein, and I'm eating very few solids. But you also have to you have to look at, you're doing really well, and your type of cancer is more fed off of proteins. I wouldn't be so concerned with that. I would keep doing what you're doing. So unless you've taken a turn for the worse that I don't know about, then communicate to me. I have breast cancer metastasis. Breast cancer metastasis, larger as well as diffuse masses throughout my lungs. I have a cough that brings up mucus. Sometimes the cough is so severe it makes me throw up, not just mucus, but meals or supplements. Oh, I'm so sorry. Right now, I'm very sore. I'm not sure what to do. My primary care provider thinks an inhaled asthma steroid would help. I'm trying the propolis right now. Okay, so what I would do is let me pull up something real quick for you. I would go get yourself a nebulizer. So nebulizers can be purchased on Amazon. I just pulled up one on Amazon. It's $59. So look up nebulizer on Amazon. You'll see a picture of a nebulizer like this one right here. And the nebulizer has a little cup down here. It's really small. It's only like 1 ounce. So you can put a 1 ounce of fluid in there, and then the nebulizer shoots oxygen through here, and it basically, that's the term nebulization. It breaks that whatever that fluid down into little teeny particles, and you breathe it in. So if you just put water in there, all you're doing is nebulizing water. That's not going to do anything. But you could put other liquids in there. This is where hydrogen peroxide solution can be really good. I don't have the formula. I should put it on a blog post. But if you look up drmccullough.com, he has a formula for hydrogen peroxide solution, which you're only using a very small percentage of hydrogen peroxide. You're not doing straight hydrogen peroxide in here. You will burn your lungs. But he has a measurement, and you can make your own hydrogen peroxide solution that you could put in a nebulizer. You could use colloidal silver in a nebulizer. That can be great for your lungs. You could use water with a drop of, we talk about biocidin, you can use biocidin in a dropper in this. That can be really good for your lungs. Another great thing for your lungs is taken orally is cordyceps. So cordyceps is a mushroom that is an adaptogenic mushroom, but it's really good for your lungs. Really good at healing your lungs. Well, we have cordyceps in a liquid. Oops, it didn't work. In a liquid product that is from Host Defense. It's called Breathe. And this is one of my favorite things for the lungs. If you take Breathe, this liquid Host Defense, it's got cordyceps and reishi and some other things in it. Take this as a product as well. So you're taking this orally as a product, but then you could put a couple drops in. If you fill your nebulizer cup with colloidal silver, let's say, then put 3 or 4 drops of this Breathe in there too. You're getting it right in your lungs as well. So this has got chaga, cordyceps, and reishi in it. But that's a great product for your lungs. People in my cancer support group are actually drinking drops of food grade hydrogen peroxide diluted water, up to 23 drops, and at least 8 ounces of water. Is this safe? So go back to what I talked about with hydrogen peroxide. Yeah, that might be fine to help kill, let's say, if you have a really bad H. pylori infection going on in your stomach. But beyond that, you're breaking that down to water and free ion oxygen, which is a free radical. That's a reactive oxygen species that could damage cells, that could cause, honestly, could be a cause for cancer. So I would not recommend that unless a person had, a specific either H. pylori infection or some sort of parasitic single cell organism parasitic infection in the upper GI, high upper GI, you know, otherwise I would not recommend it. Per earlier question, so if I understand correctly, it may be a bad idea to put hydrogen peroxide on my tumor. No, no, no. So I would say it's a good idea because it will kill any infection. So if you have an open wound, hydrogen peroxide can kill any infection. It's not going to cause any more cancer in an open wound that you're rinsing that off. So no, I would use hydrogen peroxide on an open wound. Any suggestions for low platelet counts? So there's several things that can help with low platelet counts. Oh, one is the hold on, I can just grab it or something. It's called the Mutabel Pro. Yeah, that's what it's called. So Immunobel Pro is a product that has been shown to help with low platelet counts. The only thing I don't like about it is that it's expensive. And you have to, the studies show that using it, that's this product right here. The studies using it used a lot of them. So it gets to be a very pricey product. But this is from Beljanski Foundation. But they have some really good studies showing that it can help with low platelets. See, it's $148 for this bottle, and it has 10 pills in it. Holy, jumping up and down. It's a very pricey product. Other thing that you can try, and is the red root tincture from Herb Farm. This product right here has been shown to help with low platelet counts as well. Much less, this is $14 for a bottle of this. This would be worth trying. Ultimately, you have to deal with the reason why the person has low platelet counts, and that is usually the cancer. So you're still doing everything you possibly can for the cancer, obvious. You know that. Do you have any low histamine and lower carb smoothie suggestions? I'm looking for balanced nutrition. I don't absorb protein very well from plant sources, and dairy causes me issues. I don't have any recipes like that. I do know that in your genetic action steps, and put in there a couple websites that you could go to and download their apps to look at different things like that. I have not been on those websites to do that. So I can't tell you if they have, you know, a specific low histamine. One of the sites is called Bobby Approved. It's called the Bobby Approved app. And there's another app that she listed in there. If you look at the genetic action steps sheet. I have 4 large mercury amalgam fillings and a few smaller ones. I'm scheduled for removal soon. And I believe the cavities, there are cavities under the fillings. Is this a wise thing to do at my point? I do feel peace about it, but I want your opinion. And if I should continue, how do I incorporate the supplements? If you're healthy enough to remove your fillings, if you have mercury fillings, I suggest you do it. But that has to be a call that you have to make, is whether you're healthy enough. If you feel like you've recovered your health and you're feel fairly stable, then do it, because you will spill a lot of mercury doing it, and also depends on how deep they are, how bad, how many you have, and how big of a deal it's going to be for the dentist, how much confidence you have in them. I think it's always best to get your mercury fillings removed, always best. But if a person is really crashing, they're not doing real well and not feeling well, you could be adding insult to injury trying to do it. So you want to make sure that you feel like you're fairly recovered. The only thing it would change with the supplements is that if your doctor isn't recommending you do so, you've got to make sure that you're taking a binder. A binder is a supplement that grabs onto things in the gut. And typically you don't absorb a lot of this, of what's in the supplement itself. So it's going to be typically a clay, like a zeolite clay or a bentonite clay. Activated charcoal is a binder. Fulvic and humic acid are binders. Scheelite is a binder. Those are things that you want to be taking if you're getting your mercury removed. Also, it can be beneficial if you're taking chelators. So a chelator is something that you absorb that grabs onto stuff in your blood and in your tissues. Because the idea is if you're going to go and drill these mercury fillings out, they're going to gasify, you're going to breathe them in, no matter if you have your nasal cannula in and all the protection possible, you're going to absorb some. Some is going to go into your body by you removing these. So you want to be grabbing onto as much as you can. I have the PDF of an article Dr. Mercola did with Dr. Brownstein on nebulized hydrogen peroxide and the formulas. He was banned, so unless you pay for access to his membership, you can't get it. I can email it to Dr. Connors. Thank you so much. What a team. We got a great team here. So if I get that, I can make it, I'll put it up on the member site so Dr. McCullough doesn't get mad at me if I make a blog post to make it public. I'll put it up on the member site. Hi, Dr. Connors. When we send in our cheek swabs, what exactly are you looking for? So that's why when you send in your cheek swab, do please make sure that you, let's go back to this. You look at the cheek swab information page in the member site. So on the member site, look at the goodness sakes. So let me enter in a second. That you fill out. There's a form that is on there that you can fill out. It tells me what you want me to look for. So if you are just wanting me to look for your just a general review, then you just check that box to just look for a general review. But if you're wanting me to check for something very specific, it's called the cheek swab request form. So there's a green button to download that, print that off on your computer and fill it out whatever you want me to look for. So if you're like, hey, can you look for, something maybe completely different than your cancer? So you can ask me, but I'm not going to know to look for unless you ask me. So you can ask me to look for different things. You just feel free to do that. And just fill out that form. So some people have sent me cheek swabs and don't fill out that form at all, and I just get a cheek swab. And the only way I know whose cheek swab it is because of the return address on the envelope. So don't do that. So please fill out that form and get the most out of what you're looking for. Because if I do get something like that where I don't get that form, then I'm just rechecking everything that we already checked. But so if you want me to check anything else, do that. Well, we had a lot of questions today, and I spoke really quickly because I don't know how long it takes to get through them. But any other questions before we sign off for the evening? If anybody was on Monday's call, I was doing Monday Zoom call. I will be doing Monday Zoom call for a little while. Please be praying for Anne and her family. She's got some things going on, and we want her back as soon as possible. So the artemisinin, I don't know the milligram dose of the artemisinin, but the one that the artemisinin solo is the brand that the one that we usually recommend with that. And it is a product from Research Nutritionals. It is like 250 milligrams or something like that. You take that with each. If you're taking iron, if you're taking 2 doses of iron, you take then 2. You take a capsule with each dose. All right, well, thank you guys. Thank you for your prayers, and we will be praying for you. Know that we're constantly praying for you guys, and it's a big part of my daily ritual is to do that. So because God just places you all on my heart, I consider you all family. I love all of you, and I just thank you for all you do for us. So all right, we'll get back and just make sure you keep asking your questions, and we'll keep doing our best to answer them. Love you all. Bye-bye.